Welcome to Consulting Chike. In this series, NABH will be talking about emergency codes. So let's dive in. So we'll be covering about these 7 codes: code red, code blue, code pink, code violet, code yellow, code orange, and finally code black. In code red, what you need to do is you need to remember race and pass. So first, when you detect a fire, what you need to do is you need to rescue the people who are there. If you can see there are patients, you need to rescue the patient, and at the same time you need to alert. So while alerting, how you do is there would be a designated number. You have to dial that number and say code red and the location 3 times, and you need to contain that place so that the fire does not spread. And in order to extinguish it, what you need to remember is pass. Pass is basically pull the pin, aim at base of the fire, squeeze, and sweep side to side. This is how you extinguish. This is how you use the extinguisher. And then while going out, you need to follow the fluorescent lights and the fire exits, and then go to the assembly point. Once you go to the assembly point, you need to do a head count and then close code red. There is another tip. While you evacuate, you can use a wet towel. So in order to have a wet towel, what you can do is in your office chairs, you can put a towel all the time, and whenever you need it, you can wet it and use it as a protective shield. So what you need to do is you need to protect yourself with the towel. You need to get down as low as possible, because the fumes, if you smell the fumes, you'll faint. So the air below will be breathable. Okay, so you need to get down on the floor depending upon the situation, and then crawl and go outside. Now code blue. In code blue, whenever you see there is a medical emergency or cardiac arrest, mostly it is used for cardiac arrest, you need to start CPR as soon as possible and ask somebody to activate code blue. So for activating code blue, you need to dial on the designated number and say code blue along with the location 3 times. And when the team hears about the code blue activation, the team will arrive and take over. So the way the team should take over is, when the team comes, you should not stop the compression. There has to be a smooth transition. Okay, and then the code blue team takes over. So the team members, this is very important. The team members in a code blue should have a team lead, preferably a doctor, a person who is doing compression, a person who is managing the airway, a person giving the medicines, a person keeping record, and a person handling the defibrillator. Okay, once it is successful, you need to close code blue, or it may even fail. So you need to try as long as possible to revive the person, and that is why it is very important and vital to start the compression as soon as possible. After you verify that the patient is not breathing, then you need to start the compression ASAP. Code pink. Code pink is about missing child. So either the child can be abducted by somebody, or the child can walk into some place and close himself or herself. Okay, so when we find that a child is, when we see that a child goes missing, then the first thing is we need to activate code pink, and the location. 3 times we need to say that, dialing the designated emergency number. And then once it is alerted, all the entry exit points will be closed. And it is very important to note that when you close the gates, you still need to allow people to come in. Okay, and you need to check everything before anybody leaves the premises. Okay, and the child search happens. The code pink team will get the details of the missing child, and there will be one team who will start looking from top to bottom, and there will be another team who will start looking for the child from bottom to top. Okay, and then once the child is found, then you return the child. And if the child goes missing and the child is not found, then you inform the police. Okay, and then you close code pink. Code violet. In code violet, how do you remember this? Violet sounds with violence. So that is why this color is designated for violent attendant or patient. So when you see that there is an angry attendant and things are escalating, and you want to de-escalate, you activate code violet. Okay, and then staff from nearby places, basically the whole hospital, who can come to that place, arrives at that place and circles the attendant or the patient, and then seeing that the attendant or the patient will calm down, and then a senior staff needs to intervene to de-escalate the situation, telling the angry attendant or patient to calm down and say that we will resolve whatever issues you have. Let's come to this room and let's talk one-on-one, and let us help you resolve the issue. And once it is all cool, then you close the code violet. Now code yellow. Code yellow is the longest, and for my hospital I have made the code yellow here in Kathmandu, but I'll take some time to release it. So code yellow is basically for mass casualty. When there is a mass casualty that has taken place. So first you'll get an intimation call from the police that in your place we will be sending these many patients. Okay. Once you get the intimation, what you need to do is you need to activate code yellow. Once code yellow is activated, the whole hospital will be on alert. Representatives of all the departments will assemble, and they'll be briefed about the accident, about the number of people, about the ETA, estimated time of arrival, and what they need to prepare in their respective departments. They'll go and they will get themselves ready. So like they'll prepare some ICU beds, they'll prepare some OT, they'll prepare one OT. Certain beds will be, they'll prepare certain beds in the ward. They'll also prioritize the emergency in the radiology department. Okay, and one more thing, the emergency department will already uh, should already have color bands, 4 color bands, namely red, yellow, green, and black. Okay, with numbers. You can also use certain tags in order to write details of the person once you segregate them. Okay, in emergency, there are already certain beds which are allocated for yellow, for red, for green. Okay, those are for the regular, in routine days, routine cases, routine times, normal times. Um, but for mass casualty, you need to demarcate certain places where there should be more number of red beds, red category beds, yellow category beds, and certain place demarcated for green and for black. Okay, so once the mass casualty, the all those people comes in huge number, they need to be segregated. It should preferably be done by a it should be done by a medical officer. And then the red people, they are first sent to the demarcated emergency area, and then people from ICU, OT, they'll come and take them immediately. So the reason why these department people should come to the emergency is because they need to clear the emergency beds so that more people can come in. Okay, so red category patients, they go to the either OT or ICU. In certain case, yeah, OT and ICU. And then the yellow category people, they are injured, but they are not very critical. Okay, so those people will be taken to the radiology, or they'll be taken in the ward, and the sample collection people will go there and collect blood samples from them. And the green category people, they are injured, but like first aid will do. Okay, and then these people then goes to a demarcated area. Okay, so you can assign certain OPD site. The waiting area can be demarcated for code green, for the green category patients. And finally, the black. Okay, there is a very important thing here in black. In black, certain patients which are very, very critical, and you know that it will be very hard for you to save them. You can also put them in the black category, because you need to prioritize the critical patients who you can save. Okay, and once they are all saved, then those people can be taken to OT or ICU. Okay, and the people who are dead on arrival, they'll go directly to the demarcated area for code black or in the mortuary. Okay, and once the flow of patients are done, there's no more flow of patient, then you can close code yellow. Then you have code orange. Code orange, when there is a spillage of blood. If the spillage of blood is very small, it's not flowing, it's not overflowing, then from that department itself, using the spill kit, they can take care of that. And when the spillage of blood is huge, it is more than 30 ml, then you should activate code orange, and the expert housekeeping people, certain nurses, they'll come in the location with their spill kit, and then they will handle the spill. So they'll do the spill management. The important point here is the contents of the spill kit, blood spill kit. So there are two parts basically. One is the PPE, and other one is the item consumables. So in PPE you need to have one disposable cap, a pair of goggles, mask, disposable apron, pair of gloves, and a pair of shoe cover. Okay, so that is the first part, PPE. Then you need to have a tissue roll, paper roll. Okay, and then if you are having 4% sodium hypochlorite, then what you need to do is you need to take in one bottle 125 ml of sodium hypochlorite. And if the sodium hypochlorite is 5%, then all you need to do is take 100 ml of sodium hypochlorite, 5%. And in another bottle, take, if the sodium hypochlorite is 4%, then take 375 ml of water. And if the sodium hypochlorite is 5%, then take 4 ml of water. What you need to do is you need to just mix it so that you prepare a freshly you make a fresh sodium hypochlorite solution of 1%. You need to have a pair of forceps and then a biomedical disposal bag. Yellow colored biomedical disposable bag, 1 unit. Once the spill is managed, then you close code orange. Code black. When you have code black, it is basically for bomb threats. So bomb threats you'll be getting on phone, okay, or you can have a letter sent to you or an email. So the point we are covering today is when you get a phone bomb threat. Okay, so there are basically the main part here is the bomb threat questionnaire, the checklist that you need to have. Okay, so when you receive the bomb threat call, you use the bomb threat checklist and ask questions. So these are the questions that you need to ask. So the first part is code, location and timing. So you need to ask, where is the bomb located? The building, floor, room. When will it go off? Then you ask about the description of the device. What does it look like? What kind of bomb it is? What will it make it explode? Then responsibility and motive. Did you place a bomb? Yes or no? Why you're doing that? And what is your name? So when you ask these bombard these questions, you might get certain vital information. And then other part of the checklist are like you need to mention about the background noise, about the voice, is it familiar voice or unfamiliar voice, and emotions in the tonality of the person making the bomb threat. So it is very vital that you get as many as information as possible, because these are very vital. So that is why you need to use the bomb threat checklist. And once you get once the phone is done, then you need to activate code black. So here you need to brief the operations head and security head, okay, and inform police and bomb squad and share the details. So the police and the management person in the hospital, they need to take a decision whether to evacuate, lock down, or shelter in. Okay, and the bomb squad and police will be looking for the bomb. And also one very important point, in a hospital setting or any commercial setting, you never use the word bomb. You always use the word device. Okay, so once the device is found, then the bomb squad and the bomb squad will take the appropriate corrective action there. And once it is diffused, you need to call off code black, and let the police look for it, and strictly do not touch any suspected items. Okay, and after neutralization, of course, you close code black. So thank you for watching till the end. This was another episode of from Consulting Check from the category NABH. So please like, comment, subscribe, and hit the bell icon for notification. And please keep supporting. See you again. Thank you.